Hello, welcome to the last lecture of the muscular system. In this lecture, we will talk about aging and some clinical applications of skeletal muscle. So first of all, as we get older, just typically what's going to happen with age, we're going to lose muscle mass, especially if you don't exercise. If you exercise, you can maintain it, but they say that every year after age 30 is the magic number, that you lose 1% of your muscle mass if you don't exercise. So as you go from 30 to 40, you have a 10% decrease in your muscle mass. And then remember that muscle is really important for maintaining your metabolism. So that means that your metabolic rate is going to drop with aging as well. So we know that it takes a little longer for us to respond to stimuli. There's usually reduced stamina. It might take longer to recover. You can start to lose muscle fibers, and you also lose some of the density of the blood flow, the blood vessels to your muscles. So again, these are typical effects of aging. Exercise can help decrease them, but as we get older, we just basically, our cells get older too, and they just don't work as well. So we mentioned anabolic steroids briefly when we talked about hormones. So the main hormones that we look at for muscle are growth hormone and testosterone. They're both anabolic. Now, when we talk about anabolic steroids, we're talking specifically about testosterone because a steroid technically means it's a steroid hormone, which means it's a lipid hormone. And they come from the gonads and they come from the adrenal cortex. So there's corticosteroids, which you've probably heard of. These are not anabolic steroids. Corticosteroids are things like cortisone, which we also saw. Those come from the adrenal cortex. Anabolic steroids are drugs that mimic testosterone. Now, there are growth hormone. People have abused growth hormone and taking that. That's a kind of a separate topic, but you can test for that. We talk more about growth hormone and when we go over the endocrine system. So right now we're focused on the anabolic steroids, which are basically synthetic androgens. And an androgen is a masculinizing hormone, or it's like testosterone. So obviously people take these to have protein synthesis, right? To get bigger and stronger. And you will get bigger and stronger, but you have to keep taking them the whole time because once you stop, the benefits go away. And also in males, if you're taking this, what happens is since you're taking it supplemental, the testes don't need to make it because it's made by the testes. So usually the testes shrink because basically they don't need to work as hard. But they can cause all kinds of issues. They can cause, really high blood cholesterol levels. They have to be processed by your liver. So that's, really high level. So your normal is less than 200. I've seen a college student with a cholesterol level of 800. So that's not healthy. It can affect your liver. And then we do know that testosterone affects the brain. It affects the fight or flight and the anger areas of the brain. So it can cause what they call like the roid mania or the roid rage with, excessive anger. And so these are some of the reasons and concerns with the steroids. Okay, muscular dystrophies are a group of diseases that affect your muscle. So dystrophy means it doesn't work as well. And we're going to look at Duchenne's muscular dystrophy, or DMD. So this is the dystrophin protein. We looked at that protein, remember, helps anchor basically the sarcolemma to the muscle. It maintains this structure of the muscle fiber. And so these are X-linked diseases. So you might remember that if it's X-linked, it's usually, it is passed from mother to son, because remember that women are XX, men are XY. So if you have a boy, the Y came from dad and the X came from mom. And so unfortunately with this one, there's no cure for it right now. It is it's a muscle wasting disease. It starts in early childhood. You might remember seeing like Jerry's Kids, the telethons with him. It does tend to affect boys more because they get one X from their mother. Remember, if you're female, you have 2 of these X chromosomes. So if one's normal, you won't have the disease. But unfortunately, it's just a slow muscle wasting disease. Children are often in a wheelchair. And then eventually the diaphragm fails and the children pass away. Neurotoxins. Just want to talk about a couple. So a neurotoxin is something that affects a neurotransmitter or a synapse or a nerve. We're going to look at 3 here. The first one is botulism toxin. It comes from a bacteria, Clostridium botulinum. So this is an anaerobic bacteria, so you tend to find it they'll talk about finding it in canned goods that were improperly canned. Like if you see a bulging can, it could be because there's a lot of gas produced from the bacteria. But it's anaerobic, it doesn't like oxygen, and it makes one of the most deadliest toxins known, which is this botulism toxin. And so what it does is it binds and it prevents the release of acetylcholine. So remember that if you look at your synapse, and you can see a synapse down here. So we'll look at this one real quick. So normally acetylcholine is released, it diffuses across and it binds to receptors at the motor end plate. And then its job is to depolarize that muscle, right? The sarcolemma, so the muscle can contract. Well, if you don't release acetylcholine, you can't contract the muscle, so it's going to result in paralysis. And, if you have paralysis of your diaphragm, you stop breathing and you've got like 4 to 6 minutes, right? Because your brain, your neurons are going to die. So botulism basically causes muscle relaxation and paralysis. So it's actually used for a couple reasons. One, it's used cosmetically. They'll inject it into certain facial muscles to basically paralyze the muscle so the muscle relaxes. And when the muscle relaxes, the wrinkles go away. So you have to periodically have this done. They've also used it to treat migraines because sometimes migraines are tension headaches. So they inject it in certain muscles to force the muscle to relax and to help with that. And it's great as long as it stays in the muscle. Muscles are very vascular though, so if it becomes systemic, the concern would be if it got to the diaphragm, because if your diaphragm's paralyzed, you're going to stop breathing, and then obviously that would be fatal. Now, if we look at curare is another neurotoxin, has a slightly different mechanism. So curare prevents acetylcholine from binding. So when we looked at botulism, right, we said that you basically don't release the acetylcholine. Well, in curare, you release it, but this one would actually block those receptors. It plugs them up. So it's the same result, paralysis, slightly different mechanism. This one, acetylcholine is released, but it doesn't bind. So curare is in like these poison frogs in the Amazon. So it's a poison that basically would cause paralysis. Now, another one is Clostridium tetani. So this Clostridium family is pretty nasty. It's another anaerobic bacteria. And what it does is it blocks an inhibitory impulse from a motor neuron. So remember that when we want to stop muscle contraction, we have ACHE, or you can call it ACH-ACE, was released. And that was an enzyme. And that enzyme breaks down acetylcholine. Well, Clostridium tetani makes a toxin and it prevents acetylcholinesterase from being released. So it actually targets a motor neuron and it blocks it. There is an inhibitory neurotransmitter called GABA. We'll talk about it more in the next unit, but it basically prevents that from being released. And it's GABA that says, hey, acetylcholinesterase, get on out there and break down acetylcholine. So when the toxin is present, the tetanus toxin, it doesn't allow that to be released, so acetylcholine stays in the synapse. Well, now your muscle can't relax, so we call this spastic paralysis. So this is going to cause like muscle spasms. And a lot of times they talk about lock jaw, like you can't, the masseter muscle and your jaw is clenched, so your teeth are clenched, because it tends to affect the facial muscles first. But again, spastic paralysis is still fatal, because if your diaphragm is contracted and it can't relax, you can't breathe. So again, this is one of the top deadliest toxins, and this is why we get a tetanus shot. So when you get a tetanus shot, you're supposed to get it every 10 years. Because again, this is an anaerobic bacteria. So this is, if you think about it, if you step on like a nail, right, a rusty nail, it's in the soil. It might be deeper in the soil where there's less oxygen, and you're more likely to have the anaerobic bacteria. And so you would want to make sure you have a tetanus shot, which basically can save your life because this thing is so fatal. You may have heard of myasthenia gravis. This is an autoimmune disease. So an autoimmune disease is when the immune system attacks your own cells. In this case, it attacks the acetylcholine receptors. So again, we have our motor end plate, right? And we have the ACH receptors as the little red dots. So acetylcholine binds, diffuses across the cleft, binds to the receptor, right? And we depolarize the muscle. Well, what happens here is the immune system blocks. It makes antibodies that block the receptors. Okay, well now you don't have the receptors, so you're going to have a slow, steady decrease in muscle activity and muscle contraction. So this is a slow weakness in your muscles because you have an autoimmune disorder fighting those receptors. Now, polio is a virus. I know you've heard of polio, and it's a viral disease. So we say it's been eradicated, although it's popping up a little bit. So this one attacks motor neurons. And when it attacks the motor neurons, basically now you can't stimulate the muscle. So it's, again, a slow, progressive muscle wasting disease. And again, if it goes to the diaphragm, you're going to stop breathing. So you might have seen pictures of children in the 40s that go in the iron lung, which basically was a machine that breathes for them. And so it's just largely preventable now because we have a couple of vaccines there for it. Now, there is something called post-polio syndrome, and it's a progressive muscle weakening, or progressive muscle wasting disease that basically in some individuals who survived polio, it starts to come back in their like 60s and 70s and starts to cause some trouble and muscle weakness. Now, we talked a little bit about this DOMS, D-O-M-S, delayed onset muscle soreness. So you go, you get a great workout, right? You feel good. Usually the next day you feel good, but the day after, a storm of pain. So it's usually, it peaks usually about 48 hours later. So usually 2 days later is when your muscle pain peaks from a workout. So what's going on, remember, is when you do the workout, you're having some micro trauma, you're trying to break down the muscle by working really hard, then you get inflammation, and inflammation has pain. So you get the pain afterwards. It is a sign that you had a good workout, but those micro tears are going to cause inflammation and pain, and you can see some of the issues with the inflammation that we've talked about. So, you can take anti-inflammatories that might make it feel a little better. There's some research that those fish oil supplements, those omega-3 fatty acids, help decrease inflammation as well. And so, you're going to be sore, and then it'll just take a few days and you'll feel better. Versus a muscle strain. So, a sprain, I'll write that here with a P. A sprain is going to be a ligament, okay? A strain is usually a muscle. It could be a tendon. And so how do we stretch or tear a muscle? Well, some sort of force hits it, right? And there's different types of strains, 1, 2, and 3. So obviously the grade 1 is the most mild one. The 2 is moderate, and the 3 is severe. Now, a concern with the severe is, 1, you're going to need surgery to fix it, to sew it back together again. And remember all those proteins, myoglobin, myosin, actin, those proteins can spill into the blood and go to your kidney. So you want to watch your patient's kidney function if that happens. If it's a strain, it's usually just rest, ice, right? Elevation. If it's moderate, if it's a partial tear, that's going to take longer to heal. And the surgery just depends on how bad the tear is, if they have to go in and suture it back together again. Okay, fibromyalgia, this is a kind of interesting disease. It's just chronic pain. And so the muscles are inflamed. It affects the connective tissue and the joint capsules. I don't think they're sure exactly what triggers it, but we do know there's like trigger points on the body that are usually very, very sore. And so usually they can diagnose it based on that and the patient's symptoms. It can cause a lot of issues with sleep as well. So it's a disease characterized by pain, usually fatigue, because the pain interferes with sleep. It's more common in women than men. Treatment would be things to help release the pain, things to help sleep. It can be triggered from stress, so things to help reduce your stress level as well can help with that. And then a hernia is a muscle weakness, and there's different examples of hernias. There's umbilical, which is right around your umbilical region, your belly button. There's inguinal, which is in the groin, and then there's hiatal, which is basically with the esophagus. So what happens with umbilical is you have abdominal muscles, which kind of run across and they run up and down. So if you have a weak spot in an abdominal muscle, what can happen is it can separate and then part of your intestine can protrude. This can also happen with an inguinal hernia. You can say inguinal or inguinal hernia. These are the ones where you can feel it, like when the patient coughs, you can actually feel part of the intestine move. So obviously this is not safe. So usually they go in and they'll do surgery and put a patch in to kind of support the muscle. A hiatal hernia is a different hernia. This one is associated with what we call reflux. So it's a problem with the esophagus and your diaphragm and your stomach. So the diaphragm, remember, kind of sits up here, your stomach's down here, and the esophagus comes down to the stomach. So what happens is part of the stomach protrudes, it's above the diaphragm. So more of that stomach acid gets in your esophagus, so you have more reflux. And if it's bad, then again, you can have surgery to try to repair it. And the last thing, this was in your case study in your lab manual, we can have spasms and cramps. And when we have spasms and cramps, there's lots of reasons why we can get these. It can be usually dehydration can do it, electrolyte deficiencies, if your nerves are too excited, fatigue does it, and lack of stretching. And I think we talked about this briefly already, but I just wanted to throw it in here at the end of the clinical application, because these spasms and these cramps can really, really hurt. So make sure you get enough water, your electrolytes, stretch really well as well. So that concludes our clinical applications lecture.